Spina bifida is a birth defect that occurs when a portion of the backbone and the spinal cord do not form properly during pregnancy, leading to a damage to the nerves. Hydrocephalus, on the other hand, is a defect where extra fluid develops in and around the brain of a child. It is often called water in the brain. Many babies born with spina bifida also contract hydrocephalus. William Darlington Mayinja is a 9-year-old child suffering from both spina bifida and hydrocephalus. Mayinja relies on a tube or a catheter that is inserted in his bladder to drain urine, and this is done at least 6 times a day. Owing to the delicate procedure, a high degree of hygiene is required to avoid urinary tract infections, as explained by his mother, Concepta Nalwima Katende.
We put this girl on the catheter to make it slippery. Then we'll push it into his genital part into the bladder to remove the urine.
For bowel management, a cone and warm water are applied.
I will put warm water in this bottle, then I will hang it up using this string. Then the boy will sit down. Then I will use this cone to put it into his bottom. So it will push the water into his intestines, which will soften the stool. When I remove the cone, it will pour into the bucket.
Taking care of such a child requires total commitment by a parent, but Nalwima took steps to teach her son how to manage his own care. This finally paid off when Mayinja's mother Nalwima got severe and persistent cough during the lockdown. Concerned about the condition, she went to Mengo Hospital for treatment, only to be told that she had tested positive for COVID-19. She was admitted in hospital, which proved a test for both mother and son, who were now separated for the first time.
I knew I was going to die. Again, I thought of my boy. I said, now, if I have COVID, I'm a strong person. How about my boy who has already complications? And I've left him coughing. That means he also has COVID and is going to die.
Concepta Nalwima, a teacher at St. James Bina Primary School in Weyogerere near Kampala, believes she contracted COVID-19 from her pupils in school.
Children were coughing at school, but I did not make it that it was COVID. I didn't find it out before I got sick.
While in the hospital, she worried about her son, who needs special attention daily. However, her son was able to recover from COVID-19 from their home.
I want to encourage other parents around that they should take courage and take care of their children. Having COVID is not the end.
Like many other parents, Nalwima struggled to obtain single-use cleaning materials for her son. A catheter is recommended for a single use, but with shortages imposed by the lockdown, parents and their children have been forced to reuse these materials for months.
You find a parent who is supposed to catheterize their children about 5 times a day, making a heap of sand or soil to make their children sit there, so that poo-poo and urine they just use that. I will use that single catheter, wash it, keep it, then the second time until 5 times, and 5 times times 6 months. That is how much we use these catheters.
Their supply entirely depends on donors from Belgium.
Children are most likely to present themselves with complicated health conditions that is likely to overwhelm the service provision at the end of the lockdown.
Hafisa Musubika of Chibibi village in Jinja district is another mother whose son is also living with hydrocephalus and spina bifida. During the lockdown, she resorted to using a small jerrycan of water to manage her child. Musubika cannot afford a bar of soap to clean her son and relies on flowing water to wash her son's clothes and the items she uses to manage her son's excretion. According to Ruth Naluja, the national coordinator for the Association of Spina Bifida and Hydrocephalus Association of Uganda, the lockdown has more than doubled the difficulty of over 20,000 families of people living with spina bifida in accessing service centers for help. The association has pleaded to government to intervene in availing catheters, which the Ministry of Health has promised to take on.
This issue had not been brought to our attention But in case it had been missed, the Ministry of Health is going to take it seriously.
Patrick Senyondo, NTV.